It's such a pleasure to be on, and we appreciate all you guys do. And your organization is amazing, and we're really on a mission to improve a lot of lives, and naturally, and help patients heal faster, drug free.
Awesome. So the great thing about today, Mark, is you guys have worked really hard, as you mentioned, as a company to put together great products, and you're doing it for the right reasons. So the floor is yours. We'd love to have you come on and talk a little bit about, what you guys do, educate everybody, how it's connected to oral cancer and all that great stuff.
Absolutely, it's my pleasure. Thank you. So StellaLife is a biotech company on a mission to improve people's lives by accelerating healing, relieving pain, and reducing the need for opioids and steroids. So we've created products, a mouthwash, a gel, and a spray that actually helps patients heal faster and also temporarily relieve symptoms, especially patients that have different types of autoimmune diseases, different types of chronic inflammatory conditions, mucocutaneous lesions. And we've really successfully seen our products help these patients get through their day and being able to eat. In fact, when we were at the PICOS symposium a few years ago, dental conference, a clinician just casually came up to our table and just shared an incredible story on a chemo patient just after getting StellaLife was able to eat. I mean, that was so heart touching. And, that's why we get up every day in the morning, throughout the day, to go out and improve lives. And if there's something out there, a product that can actually help these type of patients, it's really appreciated, and it's what we need to do.
Awesome. Mark, I want to make sure here, because your message is so important. Are you able to turn up your volume a little bit, or maybe get close to your microphone just a little bit more? I want to make sure that everybody hears your great message.
Absolutely. Can you guys hear me better now?
Yeah, that's awesome. Yes.
Okay,
yes.
Awesome. Sorry, I'll talk loud and clear. So what I was saying is, we're very passionate what we do. Our mission is to truly improve lives by accelerating healing and relieving pain. With 15 years of research, we were able to synergistically combine 16 active ingredients that are derived from plants and minerals that really help promote healing and really help temporarily relieve symptoms, especially patients that are autoimmune, patients going through chemo, radiation. We've really seen that with the StellaLife products, a mouthwash, a gel, and a spray, patients are actually really able to get through their day with this, and it helps relieve symptoms.
Yeah, I love that. And Robin and Linda, I know, being this the third year that we've done this, I've heard the both of you over and over just rave about StellaLife and what they provide for a lot of the patients. So I'd love to get your thoughts on, your perspective, in working with patients, and kind of how StellaLife has been such a nice fit with the work that you guys do here for OCC.
Well, I'll share first, and then you can go, Linda, if you want to. I have worked very closely with StellaLife. You guys have been so generous. StellaLife has donated product to so many of our oral cancer patients. All I have to do is say I have this patient that's getting ready to go through radiation, and a box is shipped out at no charge. I mean, it's unbelievable. And I've heard so many stories back from these people. I'll share a couple of them with you if that's okay. One of them was an elderly gentleman, and his daughter knows me personally, and he was like 81 years old or something like that, and was diagnosed with oral cancer. And she said, I know that you work with a lot of oral cancer patients, and I just wanted to tell you that my dad was just diagnosed. And I said, well, has he started treatment yet? And she said, no, he's going to in like 2 or 3 weeks. And I said, well, then I want to get StellaLife to you and get him started on that right away. And so he did, and he did it faithfully, like twice a day, the rinse, and he hadn't even started treatment yet. The man ended up with 0 ulcers in his mouth, 0. His oncologist could not even believe it. It's like, I don't know what you're doing. I've never seen this happen. So that's one instance. And to think about going through the treatment and not dealing with that pain in your mouth, because that pain is bad. I know that those ulcers, they hurt. And on top of everything else you're going through, to have to deal with the ulcers in your mouth too is just, it's what is it, sand in the wound or whatever they say. But it's so nice to be able to prevent that or help minimize it. And then had another person that I knew, another personal acquaintance, same thing. Her husband was getting ready to go through treatment. Same thing, got it to them. StellaLife donated the product. He took it all through his treatment. It was amazing. And I've lost count of how many you guys have helped with us. We really appreciate it. I've used it firsthand. I have this habit of sometimes biting my lip or my cheek, and I know that hurts bad. And I've used the gel, and I'm telling you what, it takes the pain away and it clears it up like 10 times as fast, if not faster than that, than if you don't use anything. So to me, and when I ask my practices, I'm like, do you know what StellaLife is? Some of them are starting to say yes now. It's like, I'm like, yes, the word's getting out. But I would say the majority, they don't know. So, we're doing everything to spread the word. And I hope today more people hear about it, both the public and our profession, so that you can, you take advantage of this and not experience that pain or have your loved ones or your patients experience that pain.
Mm-hmm.
Can you tell I'm a fan?
Thank you so much, Robin, for sharing that.
And I have a news story for Mark. One of the things that, first of all, the patients that I have passed it along to have just been so grateful. I've sent out like 3 or 4 boxes to UPS around here, wonders if I manufacture this stuff. And one of our dear patients is Susan Bell, Robin. She's been a long patient, or a long friend of OCC's, and we've helped her and her family several times, and she's just a real sweetheart. But I have a news story. I was recently diagnosed with sleep apnea. And before that, I saw a pulmonary specialist who gave me a different inhaler. And I'm very careful about not getting thrush with the Advair that I was on, and now I'm on Symbicort. And lo and behold, I developed a very sore spot in the roof of my mouth, and there was a lump there. I was like Robin. I was paranoid. Oh my gosh, I need to get to a dentist right now, but it's Friday afternoon. None of them will be, and I pulled out your product, put it in there, and absolutely within 24 hours, it was gone. So I want you to know there's a whole new market. Every person that's on an inhaler should have StellaLife products standing by, because no matter how often you brush and rinse and how careful you are, you can get thrush in the roof of your mouth, on your tongue. It's a very uncomfortable feeling, but it's a very scary knowing what we know enough to be dangerous. So I just think your products are the cat's meow.
Thank you. Thank you so much for sharing that. And it's like we worked really, really hard on creating something that can actually help additional patients. So it's like, I'm excited to share with you all that we will be having a coconut rinse. Yes, you heard me correctly, a coconut rinse coming out in the next few weeks, because a lot of patients have preferred, even though our current mouthwash is peppermint, it's very mild, but a lot of patients have been asking, is there something that can have no peppermint? And we worked really, really hard over a year of research and development, coming out with something with 9 active ingredients. So their mouthwash will have additional 5 active ingredients in it that will help temporarily relieve the symptoms of the dry mouth, and will really help patients going through chemo radiation.
Wonderful, because I didn't know this, Mark, but some patients are actually allergic to peppermint.
Mm-hmm. Yes.
So the coconut sounds good. I mean, if you just add a little rum, we'd probably have a great cocktail, right?
That's right.
But that will help, like Danny that we were speaking with, who
Yes.
have a lot of saliva right now too.
Mm-hmm.
So we'll be sure to get some product to him too.
And tell us about, you have a new product also, hand sanitizer. Tell us about that.
Yeah, thank you. So our new hand sanitizers are very awesome. They're actually give you aromatherapy. They're made out of organic oils. Lavender, frankincense, tea tree, aloe are some of the ingredients in it, and it actually leaves your hands feeling very nice and soft, the way it should, not dry. And we have a lot of clinicians joking with us saying, hey, no more tequila sanitizer. Now we got the StellaLife sanitizer. So we'll be sure to send you all some bottles to try. But we have a gallon size and an 8-ounce spray bottle now.
Well, I did get my spray bottle, and I thought immediately, everybody that's wearing gloves and masks, you have a whole new market out there, and that is those of us who wear masks only infrequently, but those that wear masks in healthcare daily, they all need your product.
They do, especially with everyone washing their hands, and a lot of the sanitizers have actually been recalled due to some of the ingredients in
That's
it.
right.
This is a natural product, 80% ethanol too, so it's very antibacterial. In fact, a study that was recently published showed it effective against the coronavirus, over 99.9% kill rate, and our mouthwash. So a lot of studies coming out and have came out, and yeah, the sanitizer is one of my personal favorites.
That's great.
Somebody's asking if this is available in Canada. You ship all over, don't you?
We're shipping nationwide, so it is a nationwide distributed product. We are working on having it available in other markets. Just right now, it's nationwide.
Okay.
Yes.
Did somebody say rum and tequila? Linda, did you say that?
I was just thinking about the coconut rinse.
I was taking a break, you know what I mean? And then I heard that, I was like, wait a minute, this just means to a whole new level.
Yeah. Okay. No, but OCC appreciates everything you do for all of the patients with dry mouth, and that is such a side effect for all of these patients who have undergone head and neck cancer and radiation and all of that. And I think every ENT practice should have this on their shelf to just sell right in their office. Every dentist should have it because, and a lot of people say, well, I don't think professionals should sell, but I'm a consumer. And when an eye doctor says you need such and such eye vitamins or eye drops, I don't want to go to 6 pharmacies to look for the product. I want them to have it there. And so from the consumer standpoint, I think it's a perfect product to have in every dental and oral surgery practice.
Yeah, absolutely. And we've noticed, with clinicians that have shared with us in general, that patient compliance is great when it's dispensed in the practice. And patients love it so much, they come back for more.
That's great.
It's good that it's available in many practices. And we have a provider page too. So for anybody that's looking to get StellaLife locally, there may be an independent pharmacy or a local clinician that's willing to sell it.
Excellent.
So Mark, I wanted to ask you, I don't know how much you touched on this. What was it like for you all as a company in the pandemic? There's a lot of companies, as you know, that with everything that happened in the pandemic, everybody had to get super creative. But I know there's companies like StellaLife that I'm sure a lot of your message, a lot of your mission, of what you guys have created came about before the pandemic even happened, right? I mean, these are things that you guys were passionate about on the natural side, but can you just share with everybody what this last year has been like for all of you and how, what you needed to do through all of this in order to be able to continue to, move forward and serve people?
Absolutely, John. Thanks for asking that. So we're very passionate. We're a very passionate company, and it was very important for us to stay close with clinicians, to offer any support that they would need. And especially during the shutdowns, it kind of really, and a lot of unknowns. There was just a lot going on with concerns and, of course, the virus. But we've actually stayed very close to clinicians. If we needed to donate products, we would. If we needed to expedite certain shipments, we would for elective surgeries. But as a company, what we found very interesting is that the demand for the product did not change. In fact, we started noticing increase of emails and just clinicians reaching out, wanting to learn more about StellaLife and how it can help, because there's a lot of therapeutics, unfortunately, being made across seas, a lot of unknowns. And, with our product being a natural product that's actually helping with healing and controlling pain, a lot of clinicians actually recognize that, and it's a USA manufactured product too. So we stayed close with clinicians. We provided trainings, and we also donated when we needed to, and also and helped anybody that needed any help, of course, during this challenging time.
Yeah, no question. And if that's kind of what we've been talking about a lot today is, how companies are continuing. And I love what you mentioned earlier is this tight connection between you, the feedback you get from the clinicians, all of that. And it feels like in times like a pandemic, it's not that companies were not close with the practices before, but those companies like yours that are always kind of focused on that anyways. It just feels like it made you even closer with the practice to make sure that you're connected, you're providing the things that are needed in an effort to be able to help moving forward. So that's exciting. That's great. Great news. And I do know that I do want to give a shout out. I see somebody in the chat that I have not spoke with in a while, speaking of the pandemic, Tracy Jacobs. And I think, hello, Tracy. Big shout out to her. There is a link in the comments thread for StellaLife.com. So if anybody wants more information about that. And she also just prompted me to ask a question, and I'm going to ask it, which is, any new StellaLife products coming out soon?
Yes, actually, we have a coconut rinse coming out, and I was kind of going over it earlier, and we're super excited about it because there was a lot of patients requesting a non-peppermint flavor, non-peppermint ingredient option, and we spent over a year in research and development coming out with something that's yet antimicrobial that will help dry mouth and also really help soothe pain and give you those wound healing properties, and help temporarily relieve symptoms that patients do experience, of course, going unfortunately through chemo. And the product will actually really help those patients that prefer non-peppermint. So that's going to be coming out likely in the next 2-3 months, and we're very excited about it. And we're very excited to also donate through our whole cancer cause.
Excellent.
Yeah, it's going to be available in a 16-ounce bottle, just as we have the peppermint flavor option. So its usage would probably be about 2 to 3 times a day, which is what's recommended. It'll probably last the patient about 3 to 4 weeks.
Excellent. Coconut, and then Linda, right? Coconut and rum, and right? Yeah.
Lime in the coconut.
Well, when Manal Sampat gets on, she's makes great painkillers, and I think there's coconut and rum in those. So
and if I'm looking at the schedule, she comes on at 7 Eastern, so that probably would be okay. It would be appropriate.
7 Eastern. She may bring her rum and coconut. But it sounds like a fabulous new product, Mark, and yeah, we're excited to see it and taste it.
Absolutely. And as you guys know, it's just so unfortunate with the opiate epidemic we have now.
Opiates.
Unfortunately, I lost a friend that didn't live till 21 due to opiate overdose a few years ago. So, one of the reasons I really joined this company is to help fight that opiate epidemic and help improve lives. And that's really what we've seen, across the board with StellaLife products. I mean, we have clinicians sharing with us. We have yet to see the limitations of this product. I mean, I don't know if you guys saw that the movie back early 2000s, My Big Fat Greek Wedding. Have you guys seen it at all?
Oh yeah.
When the father says the bride's father says, put Windex on it, literally everything. Yep. So we have a lot of clinicians and team members joking, put StellaLife on it, because I mean, literally, it works.
Yeah.
It helps. So,
and it's a little bit better than Windex, Mark. Let's call it like it is, right?
That's right.
Yeah, it has a very fresh taste. It really does. I like it as a mouth rinse. It's
nice.
Yeah, it tastes really good. Feels good. Yeah.
Well, Mark, thank you so much for coming on again. StellaLife has always been such a huge proponent of this Socialthon, and I know OCC and all the great work that you guys do. So really appreciate you taking the time. Keep up the great work. And we look forward to hearing more about the exciting things that you guys are doing.
Absolutely. Thank you so much for having me on. We appreciate all of you, and we're going to improve lives all together.
Thank you, and thank your whole team for us, please, Mark.
Absolutely. Thank you. You guys are awesome. Thanks.
So are you.